Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, we're going to talk about the Medicaid cuts with two leading experts, Mason Van Houweling, CEO of University Medical Center, and Dr. Brian Erling, CEO and President of Renown Health. It's all coming up next on an all-new Nevada Newsmakers. As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
Meet Nevada Houweling, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Houweling. Our plans are made for your plans.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're delighted to welcome to the program for the first time Dr. Brian Erling. He is CEO and President of Renown Health, and Mason Van Houweling, an old friend of this program, who is CEO of University Medical Center. Pleasure to have you both here on the program. Brian, let me start with you. Recently, the Grand Sierra had this shooting in the valet. What was your response when you got that call?
Yeah, we have an electronic communication system, and I got that message pop up, and obviously extreme concern. You never like to see something like that happen in our community. I'm an emergency medicine physician by training, so have taken care of a lot of traumas, including some multi-casualty events, and our trauma system at Renown, just as it is at UMC, is really a well-oiled machine. We were ready and able to take care of all the patients that came in. You hate for bad things to happen in your community, but it actually fills you with a big sense of pride that we can fulfill that role for our community.
Mason, when you saw the news, that must have triggered something in you as well after October 1st.
It certainly does. As Brian mentioned, UMC always stands ready for any incident within our community. So around the clock, as Brian mentioned, we're there for our community in these kinds of situations.
Let's turn to I wish it was happier news, but news nonetheless, which is the Medicaid cuts that are coming. What are your thoughts on them, and how do you feel it may affect the hospital?
Yeah, it's going to have a significant effect on the hospitals. At Renown, we take care of a disproportionate share of Medicaid for our community. Base Medicaid covers about 45% of our costs, so there are these supplemental payment programs that exist, and they're different state by state. The one positive out of the bill, if there is a positive, is that we do have a little bit of a runway to sort of start planning and dealing with the cuts. It's just how much can we do, because the cuts are significant. So over the next year, we're going to see decreases of the tax subsidies on the exchange. So we're going to see more people falling off the exchange. So we'll see more self-pay, more charity care. as the work requirements come in over the next 2 to 3 years, it depends if Nevada wants to apply for a waiver and delay that a couple years, we'll see more and more uninsured and charity care. And then starting in 2028, it's those supplemental payment programs that are going to get cut, and they get stepped down over the next 5 years. For us, for regional, for example, that full impact is about $33 million a year. So that's a big lift. We have the next 3 to 8 years to be trying to figure it out.
And the same for you, Mason.
Absolutely. Renown and UMC are very similar in their missions and who they care for, the communities. So we're expecting the same impact at UMC. I think there's really 3 components of HR1 that passed. There's a lot of hypotheticals early on that we were all looking at in scenario planning. What ultimately landed, we've got actuals now, so we're really planning on what that looks like for Southern Nevada. I think the big one for both organizations are what's called the provider fee. So Nevada is able to generate some dollars via revenue from the hospitals and federalize it and bring it back down to supplement the low Medicaid reimbursements that the doctor was talking about. That not only helps with Medicaid patients, but also offsets uninsured patients. And then state-directed payments programs that UMC is part of, that's going to kind of phase out and be reduced over time. I think also the work requirements. Right now there's 822,000 Nevadans on Medicaid. That's a significant number when you look at the overall population. And there's projected about 100,000 Nevadans coming off of Medicaid because of HR1 in various forms, whether it's the work requirements or eligibility and those type of things. So as leaders of 2 well-known organizations, both the North and South, we know that patients, just because they don't have insurance, don't need health care. So we're anticipating increased emergency room visits and those type of things, which is not what we want. We really want to get those patients in the right settings. So that's a big piece of it that we're looking at.
Brian, without getting into the politics of it, because I know neither of you want to do that, but the clarion cry is waste, fraud, and abuse. Do you think that's the case of what we're dealing with here, or is it just cutting the budget to pay for other things?
I think it's the latter. We don't see the amount of actual waste, fraud, and abuse that exists is very small. I mean, you hear this issue of people that are enrolled in Medicaid in 2 different states and but it's such a small fraction of what we're dealing with. So, I think it's much more about just cutting the budget. I think Medicaid has grown significantly more than it was originally intended, and sort of the people have spoken that they want to shrink that down. I think it could have been done a little bit differently and a little bit more thoughtfully.
Your thoughts, Mason?
I agree. This was kind of in the initial talking about fraud, waste, and abuse. And when you look at HR1, it was really about spending, taxes, border security, energy, and lots of other things. But Medicaid kind of got caught up in that reductions. Certainly there is a component of fraud, waste, and abuse, but this kind of goes beyond that. Just looking at even for the state of Nevada, verifying the work requirements. So every year you have to verify and your eligibility going to twice a year for those that have dependents less than 14 is going to be a problem for the state to actually implement. So again, coupled all that together, we're going to see a reduction in the Medicaid. And I agree, the Medicaid program needs to be there for the most vulnerable in some of those tough times. So, but we'll navigate it as an industry. But it is going to be some tough times for every hospital in the state of Nevada, whether you're rural or major institutions like Renown and UMC.
So, you mentioned emergency room care. It's the most expensive care. So how does that balance out in the end? Does it not end up costing more money to do it that way?
Well, I think so. I'll give you an example. When the provider fee went into place and we got that supplemental payment on Medicaid, we at Renown made the decision to open all of our urgent cares up to Medicaid. That helps keep those patients out of the emergency department. That's good for the state. That's good for the state's budget. As that supplemental payment program comes down, we're going to have to reevaluate whether we can provide that care in those sites. So yeah, absolutely. Keeping people out of the emergency department is the number one priority. And we're also a health insurance company. Hometown Health is the only Nevada-based not-for-profit health insurer in the state. And that is how you control your costs, is on controlling ER visits and hospitalizations.
Same story for you.
Yeah, absolutely. You know, that is kind of the last place you want to receive your care, and it's most expensive. And one of the things you look at, Sam, over the last 22 years, and this is NHA's tracking, that we've seen about a 5% increase overall in Medicaid reimbursement. Again, that's back to the 822,000 Nevadans on Medicaid. Now, we've had our ups and downs. We've had our bumps and reductions based off of the budget, but certainly we want to provide the care in the right setting, the most cost effective, but also not having patients wait to go to an emergency room provider. So we're very concerned about ERs getting busy and getting clogged up in the system as well.
So Metro, several years ago, came up with a plan to divert calls that were mental health related from police, fire, etc. Are you looking at perhaps setting up another system to where you can divert people who would be on Medicaid but are now not, from going to emergency rooms but going to some other type of facility?
You know, and if I could go back to what Dr. Erling talked about, the provider fee, part of that 15% federalizing of the funds were supposed to go to mental health. So that's certainly going to be a concern, that if those dollars aren't coming back to the state of Nevada, that where are we going to be able to address those dollars? So, you know, at UMC, we've started a crisis stabilization center within the last month to be able to take patients to the right providers at the right time, kind of avoiding the emergency rooms down in southern Nevada. So that's still in the early stages, but we're seeing good results of getting patients quicker treatment in the right setting versus a very busy emergency room. So we'll keep that going.
Brian, are you looking at the same kind of thing?
Yeah, we actually we had an ARPA-funded process to open a crisis stabilization center that was supposed to cover the first year to help us understand our costs and establish a rate with Medicaid. That actually got pulled back about 4 weeks after we opened the Crisis Stabilization Center, so we had to push pause on the program. We have found another source of funding through the state, and we'll be reopening our Crisis Stabilization Center this fall. We're very excited about that.
Well, it's a time for innovation, and obviously you guys are totally involved in that at this point. Let's take a break, and we'll come back and we'll talk about the involvement between the two major hospitals and the university system across the state. We'll be right back.
Rev it up during the $250,000 Cash and Wheels Guaranteed giveaways at Carson Valley Inn. Thousands in cash and free play every Thursday and Saturday. Drive away with a 2025 Ford Bronco or $45,000 guaranteed. Rev it up at the Carson Valley Inn.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity and every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling of University Medical Center and Dr. Brian Erling of Renown Health. You have partnerships with UNLV. Share with us what those partnerships involve.
Sure. You know, UMC is one of the largest public hospitals and academic medicine facilities. So we've got a lot of relationships with nursing and other technical schools. But when it comes to medical students and residents, we partner with UNLV in that space. So we've got 205 residents in almost 20 different programs at UMC. So we continue to grow. This past legislative session, the 83rd legislative session, the state continues to recognize the need to grow medical students and residencies and fellowships. So we continue to partner with UNLV, but also Renown and UNR to be able to, we have a lot of collaboration because we're so similar in our mission for teaching.
Yeah, and I was going to bring that up, that Renown really has gotten involved not just with UNR in the north, but also in the south as well. Can you share with us some of the thoughts there?
Yeah, so we have an affiliation with the UNR School of Medicine that started in June of 2021. Really excited about that. A little bit different model than what Mason has in the south. So we have the practice plan, so all the physicians and everything came into the Renown Medical Group. For example, we have shared positions. The dean of the medical school is the chief academic officer on my team. Brian Sandoval sits on our board at Renown now. All the chairs are 50-50 positions. So we have basics, science, research, and education at the medical school. The residencies are joint together with the medical school, and all the clinical trials and research happen at Renown. And it's working really well. We're just looking at continuing to grow the opportunities. We started a pediatric residency. We've applied to start an OBGYN residency, and we got several more on the list, so exciting.
You know, I've lived in Nevada since 1978, and the one thing I've known from day one was a shortage of people in the medical field in all areas. When Mayor Shelley Berkeley took office, I asked her, as she was looking to the future for Las Vegas, about medical tourism, which had been discussed under both previous Goodmans. And she said, forget medical tourism, we can't deal with our own folk. Your thoughts on that?
Oh, that sounds like Mayor Berkeley, who I know her very well, and she is a big supporter of UMC.
And very knowledgeable about medical because she was with Turo for many years.
She was with Turo. Her husband is a physician as well, and very close to the medical community. So, you know, I think we both institutions and both academic institutions are continuing to fill the gaps where we see shortages. As Brian mentioned, we've started a radiology residency, which is a major shortage. We're following up with anesthesia after that. And then we've got a couple other things that are in the queue, but they take time to develop, to get the program established, but also get the students and the residents in the program. So again, we're chipping away at it, and we're moving in the right direction collectively.
I know from health issues within my own family that, you know, trying to get appointments, I mean, in certain cases, and I'm not going to mention the specialties, but you're looking at 6 months out if you're lucky.
Yeah. Yeah, we had, when I started in November, we had, I'll give you an example, there was a 6-month wait to get in with one of our to get in with a renowned neurologist. We added 5 in 5 months. It's really how fast can we recruit, how well can we retain, and then growth. You know, we need clinic space. Our physician retention is over 95% right now. Everybody had physicians moving around the country during the pandemic, so we have a really good retention rate. Our recruiting is exceptional right now. We have over 600 providers in the Renown Medical Group and growing, and it's really as fast as we can grow them. You know, just hired 2 endocrinologists. I mean, we're trying to meet our community's needs. That's exactly what we look at. What's the time to get your first appointment, and then how fast can we get you in if you're an established patient who's having an issue, and that drives our recruitment strategies.
All right, so then the next big issue is, of course, rural Nevada. We have a significant population there. How are we dealing with that?
Yeah, and I think we collectively as Nevada Hospital Association and our rural partners are very concerned what could happen, especially as we saw HR 1 and you saw sort of the jockeying at the last minute on ensuring that federal dollars were going to provide a safety net for rural hospitals because they provide such an important care throughout our state. As Dr. Erling mentioned too, attracting physicians in specialty care has been a focus for all of us to be able to provide that, but also in a telemedicine way. I know both institutions are providing support via telemedicine for our rural partners where we can. And so those are the initiatives that will keep going to support everything from, you know, Reno down to Las Vegas, and we're very committed to do that.
Yeah, you brought up telemedicine, which was the next thing on my list here. It seems to me that this is the most natural thing and the most time-saving thing. I've watched in local doctors' offices just using computerization to set up appointments where you're no longer having to sit in a doctor's waiting room for 3 hours You now can get an appointment set and go in at a certain time, and now maybe you're there a half an hour or an hour. Telemedicine just opens up more doors. COVID really was benefited by that. Do you see that just continuing to expand now?
Absolutely. And you're right, Sam. We were not in the telemedicine business on the online care, but the pandemic accelerated that for us. We realized that there's a way to treat patients in the comfort of their own home. And so both organizations are on Epic, a world-class electronic health record that helps provide those services. But there are some resistance out there on the payer side on online care or telemedicine. So
really,
yeah, we're constantly kind of going back. They don't see it as parity as an equal in-visit stay, or visit. So again, we're constantly trying to educate and advocate that's if we can provide it in that space, we should be doing that for our patients.
But isn't that the more efficient way, Brian?
Yeah, so our rural health philosophy, and we meet with our rural hospitals up in Northern Nevada and Northern California often, is we want to keep care local. Like, it's best for people to get care in their home communities. And so we have a whole telehealth network. Cardiology is a great example, doing cardiology specialty visits in all of these areas to help keep care local. They can read the echoes that are performed out there locally, doing a preoperative visit so that when they do have to come into Reno, it's just for the day of surgery, things like that. So that's our philosophy. I mean, if you look at the reality of it, in the rural counties, about half of the patients that get admitted actually get admitted to Renown. So when they talk about this rural fund, and there's a lot of comments about the big, beautiful bill and its effect that it'll have on rural healthcare, and they created a rural support fund. Some of us are raising our hands going, don't forget about the safety net hospitals that provide a lot of that rural care as well.
All right, let's take a break and we'll come back more with statewide health after this time out.
It happens. And when it does, there's UMC Quick Care.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
Pro Group Management specializes in providing industries with the necessary components to satisfy and exceed workers' comp requirements. Every business has unique needs and specific regulations. Pro Group Management stays ahead of the curve, providing up-to-date services to keep your industry in top form. Discover how we simplify your tasks, improve efficiency, and reduce expense to keep you moving in a positive direction. Pro Group Management, workers' comp that works for you.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling of University Medical Center and Dr. Brian Erling of Renown Health. Brian, the big topic now, of course, is AI. How are you looking at that at this point in time?
Yeah, we're taking a very pragmatic approach. There's a lot of new shiny objects out there, and we're trying to stay focused on those things that make sense. We have AI-assisted documentation in multiple clinics, primary care most notably, where there's ambient listening happening and it generates a note for the physicians. That made a lot of sense to us.
So kind of like your television, your phone, they're listening to
They're
you.
listening, and the patient knows that that's happening. We let them know. But what we saw is we were looking at our electronic medical record, and our physicians were going home, having dinner, putting their kids to bed, and getting back on the computer to do notes. So we call it pajama time. Unacceptable in all of our opinions. We really want work-life balance for all of our providers and clinicians. So we put this in place. We had some folks trial it. We heard back, if you take that away, I'm going somewhere where they have it. They loved it. And so we put it in place. We have it in other areas like in revenue cycle and some other areas. It's the future for sure. I counsel folks going into the medical profession, and I would be very cautious going into a highly cognitive specialty at this point because AI is so impressive what it can do.
Wow, that's quite a statement.
Yeah.
Mason, your thoughts? We got about half a minute here.
Agree on all the things that Renown's doing, initiatives as far as ambient listening. We're looking at how can we work smarter and use it's interesting that every conversation from an outside provider or vendor, it leads with our AI product and, fill in the blank. So we're looking at, how to reduce hold times, how do we reduce some of the tasks around behind the scenes for our support staff and business office staff, revenue cycle, but also how do we make it easier for the providers to really have that quality time at the bedside with their patients.
And that's where we have to leave it. Thank you both for doing this. I really appreciate it. And would you guys come back together? I think this was a terrific show. Thank you. And we'll be right back.
Mom! It happens. And when it does, there's UMC Quick Care.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
Welcome to the Ahern Boutique Hotel, where luxury and warmth come together in the heart of Las Vegas.
We take pride in offering a one-of-a-kind experience for both locals and tourists.
Join us for handcrafted cocktails and an unforgettable experience.
Joel's Chop House, the perfect place to savor views of the Las Vegas Strip.
Satisfy your cravings at the Ahern Chocolate Shop.
No smoking, no resort fees, and the parking is always free. The Ahern Luxury Boutique Hotel is your home away from home.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
Thanks for watching Nevada Newsmakers. You can always watch our shows anytime on the website at nevadanewsmakers.com or the podcast. We have audio and video podcasts from all your favorite podcast locations and YouTube. Find us everywhere. We'll see you on the next broadcast. Thanks for watching.